Good morning friends, welcome on my channel Charming Science. Today we are going to talk about the ulna. So what is the ulna? Ulna is the bone which is present in our forearm toward the medial side. If it are going to talk about in the comparison of the lower limb, then it is homologous with the fibula bone. The ulna having a three part, that is the upper end, lower end and the shaft. How we are going to determine which is the side or what is the side of the ulna, how we will look toward the ulna. So when we are going to take the ulna, that's the end upper end having a hook like structure that is present at the upper end with its concavity directed forward, where its concavity will direct forward. The lateral border of the shaft is sharp, and when we are going below at the lower end, we will see that there is having a styloid processes which lie posterior medial at the ulna or at the lower end. So when we are going to see the ulna, we identify it by looking at the ulna that its upper end having a hook like structure in which the concavity will lies forward or it will directed toward the forward sides. When we are coming at the shaft, then we will see that the sharpest border or the sharpest border or the sharpest side is the lateral border one. And when we are coming at the lower end, we see the styloid processes, and the styloid process lie posterior medial at the lower end. So when we are going to talk about some of its landmark, then we will see we started from the upper end, lower end and then shaft. So when we are going to see its upper end, we will see that the upper end having a olecranon process. There is having a olecranon process, a coronoid process, and having a trochlear notch. There is having a trochlear notch and also having a radial notch. These are the major part or the four part which is present at the upper end of the ulna. So the olecranon process. So when we are going to talk about the olecranon process, the olecranon process is projected upward. When we are looking into the ulna, it always lies upward. From the shaft, it has a superior, anterior, posterior, medial and lateral surfaces. If we are coming at this image, then we will get to know little much about that. So when we are going to see the ulna, we will see there is having a olecranon process. It's from the anterior view. It is the posterior view. It is the medial view of olecranon process, and this is the lateral view of the olecranon process. So when we are going to see it, it's having the anterior surfaces. The anterior surface is articular. It forms the upper part of the trochlear notch. So when the trochlea, if we are seeing the anterior surfaces in the first figure, we will see this is the anterior surfaces. Then this anterior surface form the upper part of the trochlear notch. The second, the posterior surfaces. When we are saying the posterior surfaces, this one is structure, then we will see they form a triangular subcutaneous area which is separated from the skin by a bursa, and inferiorly it is carried as a posterior border. So this is the posterior surface. In the second figure we are seeing the posterior surface, and we will look, if we are going to see, there is having a triangular structure. This is the triangular structure which is present for the subcutaneous area, which separate from the skin by a bursa. And when we are coming down, it is continuous with, let me change the color, yeah, it is continuous with, we will see this as a posterior border of the shaft of the ulna. When we are going to see the medial end, toward the medial surfaces or toward the medial side of at the olecranon process, the medial surface is continuous inferiorly with the medial surface of the shaft. So when we are seeing the medial surfaces, we will see that it's going to start or continue with the shaft. This is the medial border or the medial shaft. We will see. When we are going to see the lateral surfaces, the lateral surface is smooth, as we can see here. This is the smooth, and it continues as the posterior border of the shaft. So when we are to see about the starting from the olecranon process, then we will see that it's going to continue from the posterior border of the shaft of the ulna. And when we are going to see this structure from the superior view, we will see some roughened structure at the superior part. When we are coming at the coronoid processes, this is the structure. It's a coronoid process. So at the coronoid process, it projects forward from the shaft just below the olecranon process, and it's also having a four surfaces, namely superior, anterior, medial and lateral. So let's come again at the previous image. We are going to see, let me remove all this. So when we are going to talk about the coronoid processes, we will see that the coronoid process project forward from the shaft just below the olecranon process. So this is the structure which is the olecranon process, and the coronoid process is lies just beneath that. This is the coronoid process, and it's having a four surfaces: superior, this first one is the superior, we say it anterior, second one is the posterior, medial, and then the lateral one. So when we are seeing it from the superior view, from the lower part of the trochlear notch, the olecranon is forming the upper part of the trochlear notch, and the coronoid process it's forming the lower part or lower surface for the trochlear notch. When we are going to see that the anterior surface is triangular and rough, and lower corner from the ulnar tuberosity is having a little triangular surfaces, and at the corner it forms the ulnar tuberosity. This is the place for the ulnar tuberosity. At the upper part of its lateral surface is marked by a radial notch. When we are going to see it's a lateral border, we will see that this is the part for the radial notch which is present, where the head of the radius is going to articulate Here, with the annular ligament, is attached to its anterior and posterior margins of the notch. It's having a below to the radial notch. There's having a radial tuberosity is also present there. This is the place for the radial tuberosity. And in the medial surface is just going to continue with the shaft. When we are going to talk about the trochlear notch. So the trochlear notch, it's form an articular surfaces that articulate with the trochlea of the humerus to form the elbow joint. When we are going to see this trochlear, when we are going to see the trochlear notch, we will see that here is the structure for the trochlear notch. Here the trochlea is going to articulate to form a elbow joint or the humeral joint. The radial notch articulate with the head of the humerus to form a superior radioulnar joint. When we are going to talk about the shaft, let me remove it first. When we are going to see the shaft, then we will see that is the shaft having a three border and the three surfaces at the ulna. We are going to see it in this view and in this view. The anterosseous border, or we will see, say the lateral border. The anterior anterosseous border or the lateral border is the sharpest. This is the structure of the lateral border. This border is the sharpest in its middle 2/4 and inferiorly it's from the lateral side of the head of the ulna. When we are coming at the anterior border, we will see the anterior border of the ulna. Then we will find that it's a thick and round. It begins above on the medial side of the ulnar tuberosity. So when we are going to see the ulnar tuberosity, so we will find that this is the border where it's going, of the anterior border is going, traveling like this, going like this. So we will find that the anterior border is thick and rounded and it's start above from the ulnar tuberosity and then it passes backward in its lower 1/3. So when we are seeing it from the anterior side, in the lower end we will not able to see the anterior border. It passes backward in its lower 1/3 and terminate at the medial side of the stellate process. When we are going to see the posterior border, in this structure we are not able to see the posterior border. So when we are going to see the posterior border, it's subcutaneous and it begins above at the apex of the triangular subcutaneous area at the back of the olecranon and terminate at the base of the stellate process. So we will say that this is the posterior border of the ulna. It's going to start at the apex of the, this is the apex of the triangular subcutaneous area at the back of the olecranon and terminate at the base of the stellate process. When we are going to talk about the surfaces of the ulna or the shaft of the ulna, Then it's having the three surfaces: the anterior surfaces, the medial surfaces, and the posterior surfaces. So when we are going to see the surfaces, then we will found that the anterior surface is lying. This is the anterior surface. The anterior surface is lying between the anterior and the anterosseous border. So this one is the anterior border. This one is the anterosseous border. So the anterior surface is going to lies between the anterior surface and the anterosseous border. The medial surface is going to lies between the anterior and the posterior border, and the posterior surface lies between the posterior and the anterosseous border. When we are going to see about at the lower end, when we are seeing about it's the lower end of the ulna, then at the lower end having a consisting of the head and the stellate process. The head articulate with the ulnar notch of the radius to form a inferior radioulnar joint, and it is separated from the wrist joint by the articular disc. Ulnar artery and nerves lies in the anterior aspect of the head of the ulna, and the stellate process projects downwards from the posterior medial sides of the lower end of the ulna. Posteriorly between the head and the stellate process, there is having a groove for the tendon of the extensor carpi ulnaris. So when we are going to see about the lower part of the ulna, then we will find that this one is the anterior surfaces, anterior surface. When we are coming at the downward at the inferior side, we will see there is having a groove. Here is the structure for the groove presentation. This is the groove which is present at the inferior side of the ulna. This is the groove for the tendon of the extensor carpi ulnaris. When we are going to see much below, then we will see there is having a head. Then we will see a head of the ulna. When we are coming at the more below, then we will found there is having a stellate process of the ulna. This the 7 marks is for the stellate process of the ulna. The fourth one is the anterosseous border. The sixth one is the posterior border, and the fifth one is the medial surface of the ulna. When we are going to see it from the inferior view, then we will find that this is the groove for having a extensor carpi ulnaris, or the tendon for the extensor carpi ulnaris. This is the stellate process of the ulna. There is having a articulation of the inferior radioulnar joint. This is for the contacting with the articular disc and attachment for the articulation. Yes. Now we are going to talk about the various attachments which are going to attach on the ulna. So when we are going to say the ulna, this side, this one bone or this one bone is the ulna. It's the anti. For the ulna. So when we are starting from the upper end, we will see in the posterior view. When we are seeing in the posterior view, we are going to see there is having a muscle triceps. the triceps muscles or the triceps brachii is going to insert it into the rough posterior part of the superior surface of the olecranon. At the posterior surface of the olecranon at the ulna. When we are going to see below in the, this is in the posterior view. When we are going to see more about that, then we will find that the anconeus the anconeus is also going to insert at the lateral aspect of the olecranon process at the upper 1/4 of the posterior surfaces. So there is posterior surface, there is having a two insertion, that is of the triceps muscles, and there is the another one is of the anconeus muscles. When we are coming below, then we will find that the lateral part of the posterior surfaces is going to give origin to the abductor pollicis longus. So when we are going to see it's the lateral border, we will find that it's going to give origin of the abductor pollicis longus muscles and the extensor pollicis longus. Abductor pollicis longus, extensor pollicis longus, and the extensor indicis muscles. When we are coming at the downward, at the lateral border toward the interstitial side, we will see there is having a, at the top, it's having the origin for the abductor pollicis longus. When we are coming little downward from that, then we got to found the origin of the extensor pollicis longus. At the beneath or at the lower end of the shaft, we will find there is having a origin for the extensor indicis muscles. When we are coming at the anterior view, then we will find that the brachialis muscles is also going to insert. Here is the muscles brachialis. The brachialis muscles is also going to insert into the anterior surface of the coronoid process, including the tuberosity of the ulna. When we are coming little downward, then we will find that the supinator muscles, this is the location, there is the supinator muscles is going to originate from the supinator crest and form the triangular area in the front of the crest. When we will see at toward the lateral medial side, then we will found that there is having a origin for the flexor digitorum superficialis muscles. So at the ulnar head, there is having a origin from the for the flexor digitorum superficialis muscles, that is arise from a tubercle at the upper end of the medial margin of the coronoid process. When we are coming little downward, we will see that the pronator teres muscles, the deep head of the pronator teres muscles is going to originate from the medial margin of the coronoid process. Then we will found that the flexor digitorum profundus muscles at the upper 3/4 of the anterior and the medial surface of the shaft, it's going to originate the medial surface of the coronoid and the olecranon process and the posterior border of the shaft through the aponeurosis, which also give origin to the flexor carpi ulnaris and the extensor carpi ulnaris muscles. When we are coming at the lower end, we will see that there is having a muscle originate, that is the pronator quadratus muscles, that is going to take origin from the oblique ridge of the lower head of the anterior surfaces. The flexor carpi ulnaris arise from the medial side of the olecranon process from the posterior border. We'll see in here they are the flexor carpi ulnaris. I don't think there is having a origin in this image. The extensor carpi ulnaris is going to arise from the posterior border at the groove. That's all the muscles of the ulna which is going to originate and insert at the ulna. I hope you like this videos. Thank you.